So New South Wales has over 95% of people aged 16 plus with one dose and 94% of aged 16 plus with two doses. That 12 to 15-year-old age group is still creeping up, but quite stubbornly so. So please come out and get vaccinated. The first dose coverage is 83.2% and the second dose is 78.5%. We've got 38.7% of children in that 5 to 11-year-old age group, and we're hoping to see that number continue to rise, and just echo the Premier's comments about the importance of coming forward, getting your first vaccine if you haven't been vaccinated, and also that booster dose. We've currently got 40.8% of the eligible population who've received the booster. I can't be clearer that a booster is essential in providing and maximising your protection against the Omicron variant. 2 doses against the Omicron variant are not sufficient. You need the third dose. So anyone thinking that 2 doses is enough, I can't be clearer. Please get that booster dose and get it as soon as possible. In terms of the number of cases in hospital, we have 2,779 people in hospital, including 185 people in ICU, of whom 67 are ventilated. There were 13,026 positive test results, including 5,664 positive rapid antigen tests and 7,362 positive PCR tests. Sadly, today we're reporting the deaths of 27 people with COVID, 17 men and 10 women, and can I extend my condolences to their families for their loss. Of the 27 people who died, 5 were in their 60s, 6 were in their 70s, 10 were in their 80s and 6 were in their 90s. 8 people who had received 3 doses of the vaccine, 16 people had received 2 doses and 3 were not vaccinated. And of the 4 who died who were under the age of 65, 3 were men and one was a woman, and 3 had received 2 doses of the vaccine and 1 person was unvaccinated. All 4 had significant underlying health conditions. Whilst my comments around the booster dose apply to everyone that is eligible, I particularly want to make a call out for those with chronic underlying health conditions and for those that are elderly. I think, as I tragically have read out the deaths that have occurred, you can see that there is a preponderance of people that are the elderly and those with underlying health conditions. And COVID will continue to impact on those individuals, and being vaccinated, being boosted, and taking those extra steps if you have those underlying health conditions to protect yourself, and for the loved ones around people who have got those conditions to take those common sense steps, will ensure that we keep people as safe as possible as we learn to transition to this environment where COVID will be with us. Thank you.